Debunking the myths. That's the theme of this year's World Cancer Day. As the disease increasingly affects more people around the world, we ask, what does it take to dispel the myths about cancer, and can it be defeated? This is Inside Story. Hello and welcome to Inside Story in Doha. I'm Adrian Finigan. Easing the burden of cancer. There are now more new cases of cancer diagnosed every year than ever before. And that's set to increase by as much as 70% over the next 20 years. According to the latest World Cancer Report, we're not doing enough to prevent it. A worrying trend, says Dr. Christopher Wild.
I think it is alarming if you look at the numbers. I mean, we're moving from just 14 million new cancer cases in 2012, and within just 2 decades we see this exceeding 20 million new cases. The fight against tobacco needs to be continued, and particularly in the low and middle income countries, to prevent the introduction of this habit on a wider scale. And also trying to understand how best to combat the epidemic of obesity and overweight worldwide, and physical inactivity, which are also contributing to the global burden that we see.
Well, the report paints a depressing picture of increasing cancer rates around the world. The number of new cases diagnosed globally rose to 14 million in 2012, and that figure is expected to soar even further to 22 million a year within the next 2 decades. And in the same period, cancer deaths could go from 8.2 million to 13 million a year. The report also looks at where in the world cancer is affecting people. Cancer is often seen by some as a predominantly Western disease, but more than 60% of the world's cancer cases occur in Africa, Asia, and Central and South America, a trend the authors say is due primarily to growing and aging populations. Developing nations also account for 70% of the world's cancer deaths. The report says that's partly because doctors aren't able to detect cancer early enough or treat it effectively. Well, let's bring in our guests today, one of whom you've already seen from London. We're joined by Dr. Christopher Wild, Director of the International Agency for Research on Cancer. Also in London, Jane Maher, a Joint Chief Medical Officer for Macmillan Cancer Support, and also Jessica Kirby, in London, Senior Health Information Manager for Cancer Research UK. Welcome to Inside Story, all of you. Chris, why is cancer becoming more prevalent and not less so as treatments become more effective?
Well, the reason for that is the ageing and the growth of the population. We're taking a global view of cancer, and the report that we've released today shows these marked projected increases, which mainly, as I say, reflect the population growth and the fact that it's an aging population and cancer is a disease of aging. And this is particularly why we see the greatest proportional increases expected in the low and middle income countries, where those underlying changes are occurring. Superimposed on top of that, there are also changes in exposure to factors which we know cause cancer. And it's this combination which is leading to the figures that we've released today. All right,
Chris, I mean, the figures make for pretty bleak reading. Some 22 million people a year could be living with cancer 20 years from now. Is that a worst case scenario? Is it an educated guess, or is there any way we can head off that rate of cancer, a cancer crisis?
Well, I think you make a very important point. I mean, those figures on their own do make quite bleak reading, but I think there's a hopeful message in this report as well, which is that we're learning more and more about the causes of cancer, and we think that from the knowledge we do have, if we could implement that, around 50% of cancers could be prevented. And we know also that the advances in treatment and care of cancer patients are progressing all the time. And what we're arguing for in this report is really a combined effort along those different lines in order to head off, which is increases which are not inevitable.
Okay, just to nail something that you were saying a moment ago, is it that more of us are living longer due to falling mortality rates generally, or is this increase in the rate of cancer to do with lifestyle or socio-economic circumstances?
Well, the majority of that increase that you mentioned earlier, the increase towards around 22 million cases projected forward in a couple of decades, that's largely driven by the ageing and population growth. If we add in an estimate of what the effect of different exposures to different risk factors are, then that may itself be a slight underestimate.
Jane Maher in London, welcome to Inside Story. More than 60% of the world's cancer cases occur in Africa, Asia, Central and South America, as we were hearing. Why do developing nations experience such a disproportionately high number of cancer cases?
Well, I think it's a very important point that we're discussing this the day before World Cancer Day, the International Cancer Day on February the 4th. And Africa is a particularly important area. I think there's an assumption that most deaths are due to infection, but cancer kills more than TB, malaria or AIDS, and 2/3 of deaths now are due to non-communicable diseases, rather than infection. I think there's some important preventable areas to think about, particularly tobacco. At the moment, 6% of smokers live in Africa, but that'll be 21% by the end of the century if nothing more is done about that. And that there's some very important things about preventing smoking, particularly increasing tax, because we know that if you increase tax on cigarettes by 10%, that will result in a 4% reduction in overall smoking. And secondly, in terms of Africa, cancer of the cervix in young women is a real problem, and a vaccination program and screening, catching these patients earlier, can make an enormous difference, both in the incidence of cancer, but also the distressing problems which are associated with late presentation.
So Jane, are you saying that the approach to cancer prevention needs to be tailored by geographical region? Do the reasons for the increase in cancer rates differ region by region globally?
In the UK, for example, late cancer in the over 70s is a real problem. In Africa, there are still a lot of young people who are developing cancer and who are presenting late because of the stigma associated with cancer. So I do think there has to be some degree of tailoring. The principles are the same. Preventable cancers should be prevented, but I think there are important messages which will play differently in different countries.
Jessica, Kirby, welcome to Inside Story. Now, I realize that cancer is not one, but a range of complex conditions. Why, in the 21st century, why do we still not know everything that we need to know about cancer? Why have we not found a cure?
As you've alluded to, the level of complexity in terms of both preventing and treating cancer, also in terms of spotting it early, is staggering. And we have made such an enormous amount of progress in terms of both understanding what causes cancer and how we can pick it up early, and also in terms of how we can best treat people who have it. We really are at a very exciting time in cancer research. We're making progress all of the time, and that rate of progress is only going to increase in future. In terms of why aren't we there yet, well, I think the answer to that is it's just an incredibly complex problem. But we are making strides every day towards getting closer to individual treatments for different types of cancer. And we are also improving our understanding almost daily about what increases the risk of the disease, and most importantly, what we can do to help people reduce that risk.
Do you think that cancer will ever be perhaps curable isn't the word, but in a sense that people will be able to manage their condition in order to be able to live long, productive, pain-free lives? I mean, how far off is that day?
We are absolutely convinced that there will be a day on which all cancers are essentially cured. Cancer Research UK's vision is to work to bring forward that day and to make that day come sooner. We are making extraordinary progress at the moment in terms of highlighting both policy measures which can be taken to reduce the number of people who get cancer in the first place, lifestyle changes that people can make in terms of helping people to make those behavioural changes towards a healthier lifestyle. The fight against cancer is not going to be won on only one front, and I think one of the key lessons from this report, which has been released today, is that we need to tackle cancer on all fronts in order to make a real dent against this disease and to really reduce the number of people who die. Because if we do nothing, as we've seen from this report today, that the numbers of people who develop and die from cancer will continue to increase unless we do something.
All right, as we've seen, new cases of cancer are on the rise. Here's a look at which were the biggest culprits, the types of cancer that is. In 2012, lung cancer was the most common, accounting for some 13% of all new cases and the biggest killer worldwide. There were 1.7 million breast cancer diagnoses in 2012, the most common cancer in women. It was responsible for 12% of all new cases. Colorectal cancer was the third most common, with 1.4 million new cases. That's over 9%. Prostate cancer accounted for nearly 8% of all new cases, with over 1 million men being diagnosed with the condition worldwide. And just under 7% of all new cancer cases in 2012 were stomach cancers, making it the fifth most common. Chris, what are the economic costs of the cancer burden worldwide, and how does the disease impact upon healthcare systems?
Yeah, this is a very important question, and actually it's a difficult one to answer because the components that go to make up the total cost of cancer are quite varied. I mean, one has the direct costs of trying to treat the cancer cases and care, of course, for cancer patients. But also, as has really been referred to already, when this cancer strikes early, particularly in places like sub-Saharan Africa, parts of Southeast Asia, the loss in terms of earnings and the impact on the family of losing perhaps the main income earner in that family due to cancer are huge. So there have been some estimates that this may cost over $1 trillion a year globally if one looks at the costs, and this is a significant proportion of the GDP worldwide. But I think the precise figures are difficult to get at just because of the complexity of what underlies that costing, and also that it's so specific to each particular country setting. And I think if I can just follow up on one of the earlier points that was made about perhaps the priority that should be given to cancer in the developing world, this to me is a very opportune moment, because for the first time the governments across the world are really seeing cancer and other non-communicable diseases as a block to human development. And so I think the political priority being given to cancer and other diseases is rising. And this should really help us implement some of the knowledge that we've discussed earlier in your programme about the causes, the early detection and better treatment of the disease.
So how Chris, do you go about persuading governments that things like screening and early detection programmes are actually an investment and not as a cost? How do you persuade them to look at it that way?
I think the first stage in that is actually having good information on the occurrence of cancer in the particular country of the minister that you're speaking to, the Minister of Health. And it's true that in many parts of the world we still don't have good cancer statistics. So that's the foundation, really. And then demonstrating through good research that we have tools available to us to make a difference. If I might just refer perhaps to cervical cancer screening. This unfortunately is still killing about 250,000 women worldwide each year. And yet we have very simple approaches, low-tech approaches to detecting early lesions, early precancerous lesions in the cervix of women using a simple vinegar spray and visual inspection, and the treatment on the spot of many of these early precancerous conditions. So a combination of showing what the scale of the problem is and demonstrating that there are solutions that are applicable in those countries are part of the answer. And I guess finally, what's been happening at the level of the United Nations, this political movement to link cancer and other non-communicable diseases to the development agenda itself, that this is a block to development, and I think this is changing the political landscape.
Jane, to what extent would access to affordable treatments and screening programs reduce mortality in the developing world? Does poverty affect cancer survival rates?
I mean, I think just before answering that, I just really wanted also to bring in the human cost of late diagnosis of cancer. Often cervix cancer is in young women who have a family to look afterwards, and the management of late cancer is very distressing, upsetting, full of pain, and quite avoidable. And so when we're talking about the big statistics, one shouldn't get away from that human element of it, of the distress associated with late diagnosis. Early diagnosis would make all the difference, simply because it could be treated so simply, and that the breadwinner or the person who is the core of the family would not be taken away. And I don't think you can really add that particular thing up in pure statistics and pure money.
Jessica, the World Health Organization says, indeed you were saying it yourself, that the global battle against cancer won't be won by treatment alone, and that a cancer prevention strategy is urgently needed to head off this crisis that we've been talking about. But is cancer preventable? Isn't it something that unfortunately we humans are born to suffer with? We all have these genetic anomalies. Some of us develop cancer, some of us don't.
Well, globally, it's been estimated that around half of all cancers could be prevented. You're absolutely right that our genetics, the genes that we were born with, do affect our chance of developing cancer. But so many other things affect our risk as well, from our lifestyles to our environments, exposures to chemicals and things which can affect our risk in the environment, like pollution, and also lifestyle behaviours. We've mentioned smoking before, also drinking alcohol, obesity. They all contribute together to affect our risk. And thinking in the UK as well, I mean, this is not just a global thing. In the UK, around over 4 out of 10 cancers could be prevented by changes to lifestyle. So there really is an enormous amount that can be done. I think on a global scale, there are lots of relatively simple things which have already been implemented in places like the UK. HPV vaccination, for example, is a great way of reducing the risk of cervical cancer. And as we've discussed, that's one of the really big problems in many developing world countries. We have the vaccine available, so getting that rolled out across all areas of the world is really a great way of making a big first step against that type of cancer. In the UK, HPV, sorry.
No, carry on, Jessica.
Well, I was going to say, in the UK, HPV vaccination has been rolled out, but that's not to say that there's nothing that can be done to reduce the risk of cancer over here as well. One of the key things that we'd like to see being implemented at the moment is standardised packaging for cigarettes. We've already got great controls on the marketing and sale and price of cigarettes in the UK, but standardised packaging would be that great next step to giving millions of young children one less reason to start, and to really kind of reduce how appealing cigarettes are to them.
And Chris, I just want to pick up on something that Jessica was saying there. We all know we have a personal responsibility towards cancer prevention in terms of our lifestyle choices, but what about those who have no choice over the quality of the air that they breathe, for example, or those who are unable to eat a balanced, healthy diet due to poverty? I mean, how do you ensure that governments bring in the legislation necessary to ensure that we prevent a cancer crisis?
I think you hit here on one of the really major challenges in prevention when we say that in principle, half of cancers could be prevented if we implemented the knowledge we now have. What are the barriers to that happening? And I think one of the messages from this World Cancer Report is that there really needs to be a balance between the emphasis which is placed on the individual and the role of legislation and regulation at the level of government. And we see that very clearly actually in the example of tobacco, that significant progress has been made by increasing taxation, by the ban on advertising, by the ban on smoking in public places. So it's this combination, and I think now what we have to do is look whether there are other areas where a similar approach could be taken.
All right, we're rapidly running out of time here. I want to ask you one final question, and I'd like to end on a positive note here, because it's quite easy to become quite depressed about cancer, particularly when we're talking about the kind of numbers that we're talking about here. What is the good news about cancer? Jane, we'll start with you. What makes you get out of bed each day and want to go to work?
There are now, even in the UK, 2 million cancer survivors. In my lifetime, I've seen cancers cured and people survive. When I was a medical student, metastatic teratoma of the testes was incurable. Now 90% is cured. It does happen.
So you're by no means as depressed as these figures might, alarming though these figures are, I mean, depressing though they are.
So I would say the positive thing is that there are new things happening all the time, but also that many cancers are preventable by very simple things. So I believe, having seen it, that if with the will, we can make it happen.
Jessica.
You've alluded to this already, Jane, but in the last 40 years, cancer survival rates have doubled. We are making enormous progress, and we're in the middle of this progress right now. And we have ways to prevent cancers, HPV vaccination, for example, and we've made so much progress against smoking. Really, this is only going to continue, and we will see an enormous amount more progress in future.
So Chris, it seems that while more of us in our lifetimes, as we live longer, will get cancer of some sort, more of us are surviving it.
I think that's one of the very positive messages, and the other that I see as a hopeful message from this World Cancer Report is that there's a lot we can do to prevent, and prevention works. We've seen lung cancer rates drop dramatically in the United States and in the UK. We've seen cervical cancer rates that in Finland 40, 50 years ago were the same as sub-Saharan Africa today. So those things can be achieved, and I think what I'm most upbeat about now is the recognition by governments in the developing world that cancer is something that could be and should be tackled.
So this 22 million figure that we were talking about earlier on is by no means a dead cert. We could, if we put the right measures into place now, avoid that worst case scenario.
Absolutely. This is the message of the figures, is not to be depressed by them, but really to make sure that we implement all the tools that we have available to us to reverse those projections.
And Jane, very briefly here, you
so
are
that's
nodding.
The message.
Yeah, you were nodding very vigorously here. Despite the millions that are poured into research for better treatments, you're saying that actually it's quite simple. We should start with lifestyle changes.
I think that's the message from the UICC World Cancer Day. Let's prevent what we can prevent.
Okay. All right. Thank you very much indeed to all of you for taking part in the programme today. It was good to end on a positive note on what could have been quite a bleak programme. Dr. Christopher Wild, Director of the International Agency for Research on Cancer in London, Jane Maher, who's the Joint Chief Medical Officer for Macmillan Cancer Support, and also Jessica Kirby, Senior Health Information Manager for Cancer Research UK. And thank you very much for being with us for this edition of Inside Story. Don't forget that if you want to comment on anything that we've discussed here today, we'd love to get your feedback. All you have to do is email us your thoughts. We're at insidestory@aljazeera.net. In Doha, I'm Adrian Finigan. Thanks for watching. I'll see you again. Bye for now.